Welcome to Connect, the monthly series to connect you with your community. In each episode, we will speak with experts, innovators, and community members and together explore themes of loneliness and social connections across Massachusetts. I'm your host, Sandra Harris, the state president for AARP Massachusetts and co-chair of the Task Force to End Loneliness and Build Community. With me today is my co-chair on the task force, Dr. Caitlin Coyle. Caitlin is an assistant professor at the University of Massachusetts, Boston, and director of the Center for Social Demographic Research on Aging. Welcome, Caitlin, and thank you for joining me today to talk about the work that we are doing to address social isolation and loneliness in Massachusetts.
Oh, thank you,
Welcome.
Sandra. Thank you. It's great to be here.
Okay. Caitlin, although we had worked together on several projects, we came together in summer of 2019 because we began to see how loneliness and social isolation was impacting the Commonwealth. At the time, you and your colleagues from UMass Boston were already in the field. Right. We knew that there were over 540,000 older adults living alone and at risk for loneliness and social isolation. We also saw that people were coming to us, stakeholders and community leaders were coming to ask us advice for what to do. As a researcher in the field, what were you observing and why was this important for us to do something about it at that time?
That's right, Sandra, and seems like a long time ago, summer of 2019, but at that time, I think as a gerontologist, someone who cares deeply about the aging experience, we were seeing and understanding social isolation and loneliness as a real risk factor for poor health, mental health, physical health, and a number of other negative outcomes. So we knew from the empirical evidence that this was a real problem, and we'd been thinking about it for a while, and simultaneously, as you mentioned, we were in the field, so we've been working with cities and towns all over Massachusetts, helping them plan for the aging of their population, developing age-friendly communities, and what we were seeing was really a disconnect between the empirical evidence that we know as researchers exists. So we have lots of data that tell us how badly social isolation and feelings of loneliness can affect our health and well-being. But what we weren't seeing was real evidence or development of solutions that could be implemented specifically at the community level. And so that's really where I was feeling like there was a disconnect and a gap in what we know and what we were able to do about that problem. So when we got together in that summer of 2019, it was a real exciting thing for me to think about taking the evidence that we have and also the community experiences and engagement and resources that we have here in Massachusetts to come together and think about how we can really create a network to foster solutions. And I think that's really where the task force for me was born and where we find ourselves today.
Yes. This has certainly all been highlighted by the pandemic, and we're hearing more and more about loneliness and social isolation. And it's being used interchangeably, but we know that they're different, right? Mm-hmm. I know that for me, there are times when I value my solitude, when I want to be alone, right. But there are times also, especially during the last 2 years, where I've longed for family members, longed to be with my grandkids. Mm-hmm. So as you think about loneliness and social isolation, what is the difference? And for people who are watching us today and feeling the similar feelings that I feel, are we lonely? Where do we fall on that loneliness, social isolation scale?
Sure. Yeah, it's an interesting point, and conceptually they are two different things. So we think about loneliness as really a feeling, a psychological experience that someone experiences when their desired level of social connection does not meet their existing level of social connection. So it's really that imbalance of what I would like to have socially and what I do have socially. And when that imbalance occurs, it can feel bad, and it feels like loneliness. It feels like a real sort of deep psychological sense of of sadness or loneliness. So that's how we think about loneliness and sort of how we conceptualize it. And isolation, I think, is a little bit more objective. It's really the physical absence of having social connections, and not so much even absence, but really the loss or the dwindling or the reduction, whatever you want to call it, but sort of the weakening of social ties. And so one thing I think that's important to think about when we consider isolation is that it's not an all or nothing scenario. You're not either isolated or you're not. It's really a spectrum of experiences, and people can sort of be, very well connected, but it's not quite meeting their needs in whatever particular way. And we know, as you mentioned, and as you highlighted with your example, that those loneliness and isolation can happen at the same time, and they often do. So someone has a decrease or a weakness of their social ties, and that makes them feel lonely. But it can also occur where someone is totally surrounded by people and still feels that sense of loneliness because their desired level of social connection is not being met by the people in their life. So it's kind of complicated to think about, but I think regardless of whether you're lonely or isolated, it's really important to be sort of self-vigilant and to think about our social health as being just as important as our physical or mental health. So what I would say to people who are watching, whether they think they're lonely or isolated or they're just curious, is to sort of just think about your desired level of social connection and whether or not you currently have that in your life, if that's a reality for you. And if it's not, thinking about ways to get more engaged. And that's really a lot of what our task force is trying to do, is to create those opportunities for people to be and stay engaged.
This resonates so well with me because I think we've all been in crowded rooms and felt lonely, right? Mm-hmm. As a researcher, you are seeing the data, right, coming in, especially after the pandemic. What is the research telling us about how this is impacting well-being?
Well, to some extent, it's still developing, and we're still learning, I really think, about the impact of the last 2 years on our social well-being. But what limited data we do see and have available to us suggests that it's certainly not something that just affects older adults, and that actually young people in their 20s and 30s and 40s are experiencing loneliness and isolation at high rates as well. And that's something I think is really important to acknowledge. It's that this is not just an issue about aging and getting older, but it's really a lifespan issue and a kind of a continuation of us as a species to think about the ways that we're socially connected. So I think one thing we're really that's coming out of some of the data post-COVID is really this idea that, historically as a gerontologist, we've thought about isolation and loneliness as something that happens when the people around you, they become disabled, or they pass away, or they move away, or you stop working, or your children move away from you. All of these sort of transitions that co-occur with age, we sort of attributed them as risk factors to isolation. And I think what COVID really showed us, and what we're seeing, is that it's not just about those experiences associated with age, and that isolation and loneliness can affect people of all ages. And I think that's a really important finding. And the other piece I would say, and it's not so empirically based, but one of the things that I've been really pleased to some extent to see is that COVID-19 brought social isolation and loneliness into the public conversation. We're here today having this conversation. Our task force has been recognized. We've been doing this work prior to COVID, but it's really been amplified. And I think that that's evidence that our communities and our society are really recognizing this as a public health crisis and as an epidemic. And so for me, that's more evidence. It's not quite sort of research data, but it's certainly evidence that this is a problem that's coming to the forefront, and COVID certainly had something to do with that.
I so vividly remember when we started this work, and the first thing we decided to do was to call together partner organizations who were already doing work in this space. And we started with maybe, about 8 organizations, and we decided to move out of our silos, to combine our resources and our ingenuity to make the largest impact. And now, what is it? We're over 35 partner organizations throughout the Commonwealth doing a lot of good work.
Yes. Yeah, I think that part of our mission as a task force has always been to really ensure that the residents of Massachusetts are connected to their communities, and we have always said that we're going to do that by mobilizing our networks, by really looking around and recognizing all of the wonderful work that's happening and all of the people who are working to improve community living. And we're going to give them an opportunity to come together, to communicate, to work with each other and build off of each other. And I think that concept of getting out of our silos and sharing and really working together collectively has been sort of at the core of our task force work, and something that I think we should be really proud of in terms of, we never set out to reinvent any wheels, and we never set out to create brand new ways of thinking, but really rather bringing together people and sort of building that network so that we can ensure that communities of Massachusetts are doing what they can to combat this issue.
Yeah, I remember that we started off with our regional conversation because we really wanted to understand how this epidemic was impacting local communities, you know, first responders, community leaders, and I remember that we did find a lot of good things that were happening.
Yes.
So talk about what you've done with all of this work that you found.
Yes, I know. Well, so you're right, Sandra. You know, one of the first things we wanted to do as a task force is really, we have this great task force of organizations and residents and people who are involved in the communities, and we wanted to hear not just from them, but from the people within the community. So we held these 4 regional listening sessions out in Western Mass, out on the Cape, in the Merrimack Valley, Boston, the South Coast, really wanting to understand how are people addressing this issue. We know it's not in the literature. You know, we weren't seeing it from the research side, but we knew from our age-friendly work that people were getting together and they were making things happen. And so we did collect those ideas and generated a report. It's called "It's the Little Things,"
yes.
Which actually that sort of tagline of "It's the Little Things," which is the name of the report, also coincided with the development of a public awareness campaign. So the Reach Out MA. Campaign really around that was launched predominantly on social media, but also here, you know, public cable, thinking about how community members can do small things to just make sure that they feel that they reach out to their neighbors and to think about how just renewing that social contract. We're all in this together, and in order for us to sort of get through it, we have to sort of remember that. And so that public awareness campaign yielded a number of public service announcements from elected officials all over the state, including the former mayor of Boston, Marty Walsh, and the Secretary of Elder Affairs, Elizabeth Chen. And it really, those were examples of continuing to have the public conversation and to get folks who are in leadership positions to raise their voices and to say, yes, this is an important issue in our community, and it's important that we talk about it and raise awareness. And so the It's the Little Things report, the public awareness campaign, Reach Out Massachusetts. Subsequently, we went back to the It's the Little Things report and dug a little deeper and produced a second report called The Promising Little Things, which was really, I think, the effort of my team to really think about, okay, yes, we need to have all of the great ideas on the table, but we also have to start thinking about, okay, we've got these great ideas. What are the ones that we can see are really working for this kind of community or this specific population? Because I think that's, as a researcher, something else that's really important about this topic is that it's complicated. It's a social isolation for each person looks very different, and it's got different sources, different root causes, and so our interventions have to match that. And so the Promising Little Things report was an attempt to try to dig a little deeper into some of those ideas. We also hold annual summits as a task force in the fall, so celebrating Good Neighbor Day, which is typically September 28th. Those are virtual gatherings. We've had 2 so far, and are intending to have a 3rd in the fall. And that's another opportunity for the state, communities, residents, organizations to join our table, share their ideas, give us feedback, and join us, because really that's our task force is. It is a grassroots approach. You know, we want people to join us.
I think that is so important that we allow our audience and people throughout the state to understand that our efforts are really grassrooted efforts, that we really want to be in touch with the community. And we do that in a lot of different ways. And we have, can you think of other ways, and if there any advice that you'd like to give to our people, to the audience and people who are listening to us today, of how they can become a part of the task force? What are some of the things that we're doing? I know that we've started Valued Voices. Do you want to talk about that?
Yes,
and let people know how to get involved in our Valued Voices program?
That's a great idea, Sandra. So there are a number of ways that people can involved, and Valued Voices is one of the subcommittees, one of the sort of specific goals that our task force has adopted, and that's really to bring in residents and people who can be the voice of this issue and who can share their personal experiences and their perspectives in terms of how they've experienced isolation and loneliness and sort of the ways that their communities are combating it. So it's really an opportunity for anybody to join us and to share their voice and to have that voice portrayed through the Reach Out MA campaign, and to be at our monthly meetings and to share those experiences. So that's one way. We have other subcommittees on our task force, including a subcommittee that's focused on fostering intergenerational connections. We have a subcommittee that's focused on bridging the digital divide and thinking about the use of technology in all of this. And I think all of those are sort of cornerstones of our task force, and ways for people, if any of those topics resonate with people, that they're certainly welcome to specifically join our new website. I think is probably the best way for them to get in touch with us, and that's endlonelinessma.com. And so that's a place where they can certainly get in touch with us to join the task force work. But I think, and that's the sort of formal way, right? But I think there's a lot of other ways that people can get involved in this movement and this issue, and that's really to reach out in their own community, either informally by visiting a neighbor or saying hello to a stranger in line at the grocery store, and also thinking about other ways to get involved more formally, volunteering at their local council on aging or in the school system. Again, just trying to think about this idea that we all have a social contract with one another, and in order for us to keep that contract in good faith, it's important for us to have to take a little action to do that. And then lastly, I would say, and I mentioned this earlier, but it's really this idea of being self-aware. I think we have to continuously reflect on our own social health and the ways in which we are socially connected. And I'm a new mom, and it's hard sometimes to maintain those social relationships, and it takes effort, and it takes recognition that that's important to me, and I have to make those investments. And I think that whatever stage of life you're in, to be able to just sort of admit that social connection sometimes requires maintenance, and it requires investment, and it doesn't always come easily, but it's really, really important.
Right. And I think one of the other things that we want to remind our audience is that this is just not something that affects older adults.
That's right.
As you know, we've all seen the results of a recent survey by Harvard, a research project that shows that the cohorts or young adults between 18 and 24 are just the most lonely and depressed generation. So it's very important for us to not think in terms of this just being something that older adults are dealing with,
Correct.
but it's everyone, and that it's going to take all of us to kind of help to resolve this issue.
Yeah.
I think another opportunity is to get involved in some of our age-friendly, livable
That's
communities workshop. You do community work. You do work there, and
Sure.
Can you make some recommendations on how people can get involved in their age-friendly,
Yes.
livable community work?
Right. So for those who aren't familiar with the age-friendly framework, it was developed by the WHO and has sort of more locally been adopted by AARP as a commitment by communities. So they really express a commitment. They have to apply to become an age-friendly community and engage their local officials to do so. But it's really a community improvement process is the way I like to think about it. And it's ideally spearheaded by a combination of residents, local officials, who are coming together to recognize what are the strengths of our community as a place to age, whether you're aging, sort of that whole birth to death kind of aging. What are the things that make this a good and engaging, livable community? And what are the places where we can do better? And they really sort of put together plans and execute action to try to improve their standing, so to speak, as an age-friendly community. So that's something that's happening all over the state of Massachusetts. And the ways you can get involved are really to go to your local community, particularly the senior center or the local public health department, and just inquire about their status as an age-friendly community, and if you're interested, willing to chip in and participate in some of that work. But it's really community improvement with the aging lens.
Right. At last count, at least the last information I have, we had over 94 age-friendly communities in Massachusetts, and that's just incredible.
It is.
It's just, I'm so proud to be a Bay Stater because of that reason. And I also want our audience to know that we are an age-friendly state.
That's right.
So that's very, very important. We have so many committed partners around our table from throughout the Commonwealth and beyond. One partner is Caitlin Coyle, the founder and executive director of Social Health Labs. Caitlin studied solutions for loneliness and social isolation at Harvard School of Public Health right here in Boston. And she brings expertise from her work to address loneliness nationally. She will serve as our field reporter in this series. We're really happy to see Castley join us in this particular way and interviewing guests in upcoming episodes. Welcome, Castley. Can you please share your perspective on the work being done in Massachusetts and how it's impacting our nation?
Thank you for the introduction, Sandra. It's been my honor to be involved with the task force over the past 2 years. Through my work at Social Health Labs, I get to see a wide range of innovative ways that people are reducing loneliness and strengthening community connections, not just in Massachusetts, but also across the United States and around the world. I've collaborated with technology companies who are building apps and digital tools to help people connect more meaningfully online. I've supported healthcare providers who are screening for loneliness in the doctor's office and prescribing social connection. I've spoken with government officials who are implementing legislation at state and national levels to help reduce the burden of social isolation. And I've worked with architects who are designing neighborhoods and cities with human connection in mind. Sandra, Caitlin, and all our partners on the Massachusetts Task Force to End Loneliness and Build Community are at the forefront of this innovation. We are the first coalition that is truly bringing together organizations across the state to tackle loneliness together. In upcoming episodes, I'll be interviewing some of the amazing individuals who are leading this work in Massachusetts, and I hope that you'll be as inspired by their efforts as I am. But what's missing is your participation. We would love for you to get involved, whether that's by contributing to the task force or by taking one action to reach out and connect with someone in your community today. It could be as simple as striking up conversation with a neighbor, calling a friend, or volunteering with a local nonprofit. We will be sharing many more ways for you to connect and new ideas for you to try out in upcoming episodes. With that, Sandra, I'll turn it back over to you.
Thank you, Castley. Caitlin, as we wind up this episode, what advice would you like to share with audience members who are just not sure if what they're feeling is loneliness? Mm-hmm.
Well, what I would say to them is, we've been talking a lot about getting involved in community and the opportunities that our task force is creating for people to do so. But I think it's also really important to recognize that getting involved on the sort of community level is not for everyone. And it's really okay that it's not for everyone. As I mentioned, isolation and loneliness are very individual experiences that look different for each person. And so what I would recommend to viewers who are wondering about their levels of isolation or loneliness is to really recognize that they don't have to get out and join a committee or get involved, because that might not be for them. But what's important is that they recognize the importance of social health, and they think about what are the things that would make them feel more connected, and take some action, reach out for a little help to figure out how to get better connected, because there are lots of ways in Massachusetts to do so.
Yes. Caitlin and Castley, it's really my honor to be a partner in this work with you and all the other partners around the table. We have done so much in a short period of time, but yet we know there's still a lot left to do. So I look forward to continuing this journey with you, and we're going to go out there and do it for the state of Massachusetts, and for all of our audience members and people out there, helping to really make a difference to build community and to end loneliness.
Yes.
We look forward to continuing this conversation on how you can connect and build community in your neighborhood. Tune in next month to learn about the value of intergenerational connection and hear from local nonprofit leaders who connect people across ages. Until then, please visit our new website at endlonelinessma.com to learn more about the task force and how you can get involved. Thank you so much, and see you next time.